Hello everyone. This is just a overview of the general hematology session today for those who are not a channel member. Just to remember the important points from this session. The first question was about autoimmune hemolytic anemia. When you are asked about listing anything that lists the causes of autoimmune hemolytic anemia or sickle cell crisis, just list them. Do not write details about it. Then the second part was about emergency issue. It means the emergency management of the autoimmune hemolytic anemia, whether he need blood transfusion or patient need blood transfusion or not. The acute management with steroid IVIG, etc., and the prophylactic medication for that as well. Some of the people have written very long and lengthy answers. Obviously, they will not have been done this in 40 minutes. You need to be a bit judgmental of your time because you have only 40 minutes to complete your answer in the exam. So time management is necessary. Then among the treatment section of the autoimmune hemolytic anemia, always mention trial that you will offer trial to your patient. Many hospital has trial open, especially the tertiary hospital. So if you mention trial, that is better. They do not expect you to write the detail of the trial in your answer. But if you mention the name only, if you know the name, it carries positive marks. For the management, follow the management mnemonic, which have been shared in the planning FRCPath session as well on 5th of April. You can watch the session on the Hematomorph website, or you can watch it on the YouTube if you are a channel member again. We have shown you the management mnemonic, how to apply this mnemonic to your management question. Then do not forget follow-up section in management question. If they ask you how will you manage the patient or long-term management of the patient, do not forget the follow-up patient because you do not disown the patient after treating them acutely. Hematology patients are followed for years and years in your daily practice. Then the second question was about sickle cell crisis and preconception care with updates in sickle cell disease world. So again, the question was listing the trigger of the sickle cell disease. Many people have written long list of sickle cell trigger. They are not necessary. You need to mention the common one only. Then emergency management, pain is the main issue. Pain was the main issue in the scenario. You need to address the pain first, and then the other bits of the acute management. Then the second important thing was to mention your transfusion, at which point you will consider top-up transfusion, and at which point you will consider the exchange or transfusion for the patient. And then discussion about hydroxychloroquine because this patient has multiple recurrences of the sickle cell crisis that would need management as well in the long term. Then mentioning about the consent of the hydroxycarbamide and precaution or cautions related to the hydroxycarbamide because it is the teratogenic drug. Then when you mention the management, do not jump to the treatment section directly. There's a difference between management and treatment. Treatment start with clinical assessment. Management start with clinical assessment. Treatment start with the name of the drugs only that you will give to your patient. So if you mention that you will manage your patient, it means you will start from the clinical history and examination of the patient, consultation with the patient, discussing the treatment options, and discussing the follow-up of the patient as well. Do not forget follow-up. Many people in their answers have forgotten the follow-up. Many people have started the management question from the treatment directly, which is not the correct way to answer the management question, because you will lose uh, a lot of mark if you do not mention clinical assessment, consultation, investigation with the patient. Because when a patient come to our clinic, or when we go to the patient during ward round, um, and the patient is new and we are seeing them for the first time, we uh, ask them about the symptoms, then what investigation we have, then we tell them the result of the investigation, and then we tell them our plan of treatment. Then after that, the next question was about updates in the sickle cell disease world. There are many updates recently. Sickle cell disease is a very evolving disease these days. Many treatments are coming and many are getting stopped. You should be knowing that the voxelotor and cresenlizumab has been stopped, and we have now Casgevy approved by MHRA in 2023, option of allogeneic stem cell transplant as well. So in essays, you should know how to adjust your time. If you spend too much time on first two essays or on your first essay, you will have obviously less time during the exam. This was your first attempt for the essay. With passage of time, you will be able to write your essays um, in 40 minutes. And adjusting your answer in 40 minutes is a skill which you will learn with more and more practice. You will come to know what has to be written and what has not to be written. All of you are brilliant. You have a lot of knowledge, more than me, but how to um, put them in your answer during the exam is a skill. So if you know the skill, exam is easy. If you write a lot of stories in the exam, it will waste your time. You will have less time for the remaining essay. You will get stressed, and during stress, people make a lot of mistakes and even blunders, which can cost their essay and which can cost their exam as well. So that's why many brilliant people fail the exam, because they write a lot. They do not have judgmental skill of the time management. And this will come with the practice. If you continue to practice, for I'm sure you will learn how to attempt the essays. And the next session will be about transfusion. I will be posting the question tomorrow evening. And then thanks to those who have attempted the essays, there are almost 10 people, and those who have donated, I have given them individual feedback as well. So see you next week.